At this moment in time, SU Dental is not seeing NHS patients. Now, this is a little bit of a sad news for many of our patients because we've historically been an NHS practice going right back to pretty much 1950. So now after 70 plus years kind of not seeing patients from pretty much the inception of the NHS is difficult. But this is a problem that unfortunately has been in the making since probably about 2006 when the government introduced what they regarded as the new dental contract. So following a number of things that's happened, we're now in a situation where the dentists available to work on the NHS or willing to work on the NHS has decreased considerably. Now this is a national issue, so this isn't just limited to us as a practice or just the location, but nationally a lot of dentists have left the NHS because of the working conditions. The problem with the NHS service at this moment in time is that it works on a thing called the UDA, which is basically it's called the Unit of Dental Activity. So unfortunately, as with everything with the cost of living crisis and people concerned about pay and wages being able to pay the bills, money is a big factor in what's causing this. And dentistry has been underfunded pretty much since 2006 when the government ring-fenced the dental budget. So there hasn't really been new money into the dental service, but only a recycling of what goes in. So the unit of dental activity is basically how dentists are paid, and they're paid according to the number of units of activity they do. And certain treatments are put into bands. So there are 4 main bands. There is the band 1, which is an examination. Band 2 is for treatments such as fillings, root canals, extractions, and dental additions. And band 3 is for lab-based work, so predominantly dentures and crowns or mouth guards. Now, band 4 is an emergency treatment band, so anything you've broken a tooth and you need to be seen for an emergency, it covers that. Now, the problem with it is that every time you do a band 2, for example, it encompasses the band 1 fee and the band 1 treatment. So a dentist gets 1 UDA for an examination, gets 3 UDAs for a filling or anything that falls into the band 2 category, so fillings, and gets 12 UDAs for the advanced lab work. And everything that comes prior to that, so if you needed a crown and a filling, the dentist would get 12 UDAs because the filling is encompassed within the 12, and so is the examination. Now, on the basis of it, you might think, well, 1 UDA is enough, okay, or 3 UDAs is fine for a filling. But if you needed 2 fillings, 3 fillings, 5 fillings, it's still 3 UDAs. And the dentists generally are remunerated for only 3 UDAs. So there's a disparity between the number of fillings that we might do and the money that the dental practice and the dentists are paid. So it doesn't make sense if I asked anyone in a kind of rational thing to say, well, I'd like you to work 5 days, but I'm only going to pay you for 1. And to do that consistently, it causes problems. So the first issue is kind of this methodology, because it's not about how many fillings you do for dentists. So there isn't this thing about, we just want to do lots of fillings. It's about how many patients you can see and how many people you can get in and out. So that doesn't really allow someone time to provide the care they want because you have to hit your target. And the threshold for the target for most dentists is 96%. Now, if I asked you to do an examination, any test, and I said your pass mark is 96%, you would rightly be a little bit worried. And so each year, dentists have to focus on hitting a 96% target. And if they don't, the government takes the funding back. Now, as a business owner, the problem with that is that we have fixed costs. We employ staff on the basis that we provide the target that we need to, but we don't know who's coming in each year for what they need to do. So there's a very large variable that comes into play. So there were problems right from the beginning with the outset of this contract, but dentists are resourceful and we try to make it work. The problem really kind of hit home was in 2010, the government realized this wasn't a great contract. And so for 10 years, they piloted a new dental contract. And S3 Dental Hair with Teeth was actually privileged enough, I say privileged enough, to be part of that. And it was actually a decent contract because it focused a lot more on prevention. And pretty much up to the week of the pandemic, the government, or part of the government, was actually interested in pursuing something that went down this road. Now, COVID happens and a lot of things changed. And the government decided to scrap 12 years of research and ignore it. And we've heard comments that the government is looking at dental contract reform, but unfortunately we're at a stage at this moment in time where the government is not able to function as effectively as we'd like. We've had, I think, 3 health secretaries in the last 6 months. So there are problems inherent. And with the cost of living and with the way that we, as a practice owner, everyone pays, it's privately owned. So everyone's wages and the cost of materials since Brexit meant that these are rising costs that have gone up, as well as the electricity, the maintenance, and the increased regulation for dental professionals. So all of these costs have gone up, but the government has not put new money into the service. You hear stories about money being made available, but personally, I don't believe this is new money. And the way that it generally works is that the fee that patients have been paying from 2006 has gone up. And it's gone up fairly steeply for some patients. I think it was £14 at the time, and now it's up to £23.80, 60. So it's gone up quite a bit, but that money has essentially been offsetting the contribution that the government makes to NHS dentistry. So it's a stealth tax. So as your costs have gone up, the government's investment in NHS dentistry is less. And worryingly, the government has never funded for 100% of the population. And it only does it for 50%. So 50% of the population, in terms of the government's calculation, feels that shouldn't need NHS dentistry or don't need to pay for NHS dentistry because they can afford to go private. Now, that depends on the area that you live, but I think a lot of patients would object to not funding the service properly, which, as clinicians, we also have an issue with the service not being funded properly.